I am speaking with U.S. Representative Angie Craig. And Representative, you just got back from Washington, D.C. over the weekend. Kind of fill me in on the pulse out in D.C. We're getting briefings and updates and any kind of media you want to turn on talking about what's happening in D.C. and New York. So can you kind of just give me an idea of how things were as you left?
Well, you know, things are moving so fast right now. When I left, we were particularly focused on passing a supplemental bill that would do a few things. One, we need to make sure that coronavirus testing is free, and once we get the capacity to test, that it's available to everyone. That is something that is a real challenge right now in the state of Minnesota and around the country, that there are supply chain issues related to the reagent needed to process the test. So that is something that certainly I have spoken to Vice President Pence about, to the task force about, and the Minnesota delegation has encouraged them to sort through that as quickly as possible. The other thing that we did before we left town, we took a vote at almost 1 a.m. on Saturday morning, is to provide to 78 million Americans paid sick leave in the event that they are affected by coronavirus. We don't want anyone to come to work. We don't want anyone serving the public if you're sick. And unfortunately, a lot of our neighbors don't have access to paid sick leave in the way that many of us do. So those were two of the big things: giving states and local communities additional Medicaid support so that we can cover some of these expenses. And then, you know, this thing continues to evolve. Only yesterday, of course, the governor announced that the schools would be closing, all of them, by Wednesday. And we continue to hear from the Hospital Association that we all need to help our neighbors, because if we stay home, if we stay safe, we can help flatten the curve for this pandemic. And if we do that, then together we can help our hospitals with the capacity constraints that they're under. So this is really going to require a community effort. It's going to require sacrifice on the entire community. And I would just say, please, please listen to the public health experts who are saying we really have to prevent community spread as much as possible by staying home.
How are we on getting more access to these tests? I know that you said that you were going to be speaking with Mayo Clinic and some of the other hospitals within this coalition or association to get more access.
Well, the federal government has obviously on an emergency basis sped up some of the validation that's for additional testing. Most of this is from in the private sector. And so, you know, there are really two things happening here. One, the government test, which does have severe capacity constraints, and of course institutions like Mayo that have really sped up. It looks like they're going to be able to scale up, but that scale up is going to take time. And at the end of the day, we need to be able to test about 15,000 Minnesotans a month, and we only have the capacity to test today, it seems, fewer than 200 a day. So we've got capacity issues. We've really got to ramp this up. The public health issues have got to be the very first priority. And, you know, small businesses are already reaching out to me. Let's solve the public health crisis, but obviously we also need to be cognizant that we've got a lot of small businesses that are struggling right now, and the Small Business Administration has recently issued some guidance that my office can get to folks if they give us a call.
Representative Craig, we are certainly thankful for our teachers, as you said, thank our teachers, our healthcare workers, but also to our lawmakers who are doing things in a bipartisan fashion and doing things quickly. So thank you.
Thank you so much.